The consequence of the coronavirus pandemic may be more devastating than the disease itself for the world's poorest countries as the global economy dives into recession. The biggest fears of the United Nations are that unemployment, poverty, as well as hunger are getting more intense. Although so far COVID-19 has been for the most part a disease of the rich, because 74% of all the cases and 85% of all the deaths were reported in Europe and here in the United States, the truth is that the vast majority of the world's population live in developing countries. According to the recent report released by the United Nations, the global unemployment rate is at 8%. But in developing countries will be hit by the most damaging long-term repercussions. Several reports were produced around the world in recent weeks, highlighting that the risk that poverty and hunger could end up killing more people than the coronavirus. There's roughly 2 billion informal workers in the world. 2/3 of them have already lost their source of income, and the vast majority of them are in developing countries where most employment is informal and rely on daily gains to eat at the end of the same day. As a consequence, the World Food Program of the United Nations warned that a hunger pandemic could outweigh the coronavirus pandemic. 130 million people are expected to die of hunger, and 135 million are expected to suffer from hunger this year, making the risk of starvation a reality for 265 million people in the world. At the same time, it is important to clarify that the problem is not a shortage of food. According to the same study, there is plenty of food being produced. The problem is that the lockdowns triggered short-term supply problems as well as shortages of specific products. This made meat and fruit more expensive and out of reach for the poorest. In Africa and in Latin America is happening the same thing as it is in India, where roughly 65% of the population live in crowded informal settlements where social distancing is virtually impossible. In a recent survey in Africa, 85% of those who have been forced to stay home said that they were either skipping meals or eating less because of the lockdowns. The United Nations Children's Fund warned this week that the problem may get worse as the diversion of resources from existing health programs is allocated to fight the coronavirus. This could lead to over 1 million extra deaths among children under 5 years old in the next 6 months. That's 6,000 children in a day. The good news is that so far, the worst forecasts of the coronavirus contagion in poor countries have not yet materialized. India and the continent of Africa account for 1/3 of the world's population, but have reported only 3% of the coronavirus cases. Although the low testing rates probably explain the numbers in these countries, a good indicator that COVID-19 is not hitting developing countries as badly is that hospitals and health systems are not being overwhelmed by large numbers of patients. In India and Africa, about 3% of those who have tested positive actually died because of the coronavirus, compared to the 6% here in America. From Miami, I am João Freitas for the Digpu News Network.